Kelly?
Thank you, Chairman, and thank you all for taking a day out of your life to come down here. We've been attempting since the session started to go out into the country. So we were in Oklahoma one time, and we were in West Virginia another time, in very small communities. And Ms. Moore, I'm also in the automobile business. So I'm really interested, you know, when I looked at your input for this, and I hear your testimony, I can't help be impressed by your story. What you and your husband have been able to accomplish is the American dream. I don't know that you had a lot of government help doing that. I think once you became profitable, the government came knocking, and we find many ways to shake pennies out of people's pockets because we're going to do it the right way. And we're only $33 trillion in debt, so I would challenge anybody, if you want to watch a model, please don't bring anybody here in to tell you how to run your business. So, but looking at what you do, and I know this because I'm the same way, and the same as Mr. Nicewander, how many sleepless nights do you have trying to figure out how you're going to make payroll? And how many times do you have to you pay everybody but yourselves in order to keep that talent there? Now, you did talk a little bit about inflation because there's many times we talk about things and it kind of takes your mind off of what's really happening in your store, in your neighborhood, in your county, in your state, and in your country. So can you talk a little bit on what inflation and supply chain disruptions have how it's impacted your business and how you've had to adjust to the benefits that you provide for your employees?
Well, with the supply shortages are critical. I've shared this with a number of people, but in key lines, we're getting shipped at 40 to 60% of what we order. When those orders come with a discount, which we then are able to pass on to our customer. When we cannot secure those with a discount, we're having to get rapid items much more expensively. So it's driving up not only our costs, but also the costs of our customers. Putting a hurt on the small business customers we have. Not everyone is a giant corporation in our area. Most own a garage or diesel mechanic shop and help out with the stone haulers or the cement workers. The fleet garages are our big customers. So supply shortages continue to challenge us. We're thinking of creative ways. We're looking for outside suppliers, but then you have a product that you may not be familiar with, you may not have experience with, so warranty items become an issue.
Yeah, and you know, we're in the same position. I think any of us that are in businesses know how tough it's been to attract talent and give the benefits package to them that they need to have in order to, because you're in competition with everybody else that's looking for talent.
Yes.
So the benefits package is a big deal. So Mr. Nicewander, just between the two of you all, I said, and I'm sure Vern's gone through the thing, there's many nights without sleep. Miss Miller and I agree on everything because she's also an automobile dealer. But if you all can talk about it, because it comes down to this. We're talking about health care and how it is soaring, the cost of keeping people healthy. What is it that we could do? And you want to keep these benefits there to attract the best people to address the people that you serve. So, Mr. Nicewander, I don't know how you've done it, but having health care in a rural area, being able to take care of those folks and knowing that your model for a profit is very small and leaves little room for any types of mistakes. And that's why I think we keep talking about we're going to get good health care for people. Say, I really appreciate that. I can't afford anything we're doing right now. We started off at 80-20, then we went to 70-30, then we went to 60-40, and right now we're contemplating going to 50-50 because we can't afford to be in a competitive area with another person who sells the same products as we do, and it all is based on total cost of operation. So, Mr. Nichols, just share a little bit. I mean, for you to do what you had to do, and keeping the medical part going right now, the rural part, and calling on people and trying to keep them healthy.
There's a word that my colleagues here and some of you had mentioned, and it's the word affordable. And you talked about the out-of-network ambulance ride. You tout uninsured Americans. What good is that insurance if they get a card with their name on it, but they can't use it? Access to healthcare is a problem. Mr. Doggett mentioned maintaining, keeping rural hospitals open. Texas leads the nation in closed hospitals in the last 10 years. In my state of Tennessee, 16 hospitals have closed in the last 10 years. 13 of those have been in rural areas. My hospital in my county is on the verge of closing. The county next to me just closed last year. Access to healthcare is a problem, people. It's not affordable. Families are having to drive from my practice over 2 hours to get to a specialist, as simple as an ear, nose, and throat doctor. It's not that there's not one closer. Medicaid pays, on average, about 60 cents on the dollar compared to commercial payers. What physician's office wants to accept that? They drive past 10, maybe 20 specialists to get to the one that will accept their insurance. People in my community don't make a lot of money. $36,000 is the average income. You're asking them to pay a $14,000 deductible, drive 2 hours to get to a specialist, take a day off work that they can't afford, that's going to take food out of their kids' mouths. Affordable Care Act is anything but that.
Thank you.
I now recognize